Ça, c'est mon micro, hein?
Ouais, tu peux faire un 1-2 si tu veux.
Ouais. En fait, c'est pas mon...
Check, check. 1, 2, 3, 4, 5, c'est bon.
Parfait.
Hey, je t'entends, genre.
Hey, c'est bon.
Tu as baissé un peu pour pas qu'il soit blowé up.
Ouais. Ben, moi, s'il n'y a pas personne sur Zoom, j'irai même pas demander si c'est des questions sur Zoom.
Peut-être qu'il est trop haut, fait que j'ai...
This might take several minutes.
Oh non. La pénalité, j'ai essayé ici, Jacques, là.
Don't turn off your PC.
Puis là, on commence, là, on va regarder, c'est toi, c'est du monde qui joint.
Il est dessus?
Non.
OK.
Fait que tu joindras pendant la conférence.
Pendant la conférence.
C'est garde, je vais t'aider sur le caméra. Ouais, c'est là.
Ah, mais au pire, je vais dire...
Ouais, c'est ça.
Recording in progress.
Mais voyons donc.
Ça enregistre pas vrai?
Ouais, c'est comme ça.
Tu sais qu'avec le iPhone à ce temps, le nouveau OS, tu peux enregistrer les conversations au téléphone. Fait que tu as une icône en haut à gauche.
Hey, ça se
Fait que si, mettons, tu appelles, mettons, ton avocat, tu dis, écoute, juste pour prendre des notes, là, je peux tout enregistrer.
Okay, 30 seconds, heads up.
Là, tu pèses là-dessus. Ça t'envoie ça dans les notes. Après.
Ça te le traduit-tu? Ça te le transcrit-tu?
Non. Pas pour l'instant.
Okay, heads up.
Good morning, everyone. Bonjour tout le monde. Thank you for joining us today on this important occasion. Merci de vous joindre à nous aujourd'hui à cette occasion importante. My name is Dr. Ayla Azad, and I'm the CEO of the Canadian Chiropractic Association and co-chair of HEAL, Organizations for Health Action. Alongside me is Elisabeth Fowler, CEO of the Canadian Ophthalmological Society and fellow co-chair of HEAL. I would like to begin today's announcement by acknowledging we gather here today on the traditional unceded territory of the Algonquin Anishinaabe Nation, including the Huron-Wendat, Haudenosaunee, and Anishinaabe peoples who have lived on this land since time immemorial. Organizations for Health Action, otherwise known as HEAL, is a coalition of 43 national health organizations dedicated to improving the health of Canadians. Our diverse members include professional associations of regulated healthcare providers and organizations of health charities that provide a range of essential healthcare services across Canada. Together, we represent over 600,000 health professionals across the country dedicated to improving health outcomes for all Canadians. Today, we are proud to announce the release of HEAL's consensus document. This document outlines 3 critical areas of focus that must be prioritized to create a sustainable healthcare system that meets the needs of Canadians today and into the future. The healthcare system we built decades ago requires innovative approaches to re-envision the healthcare services that are so crucial to Canadians today. Increased funding, more agile approaches, and systemic reform are all needed to ensure that Canadians' health needs are met now and into the future. The 3 pillars we will discuss today are addressing the health human resource crisis, investing in mental health parity, and enhancing community-based care. If implemented, the key recommendations outlined in this consensus document will enhance the accessibility, quality, and sustainability of healthcare services for all Canadians. Elisabeth.
Thank you, Ayla. Regarding Canada's health human resource crisis, our system has been under significant strain, economic, resource, and infrastructure strain for years, a situation exacerbated by the COVID-19 pandemic. En ce qui concerne la crise des ressources humaines au Canada, notre système est soumis depuis des années à de pressions considérables sur le plan de l'économie, des ressources et des infrastructures, une situation exacerbée par la pandémie de COVID-19. Despite long-standing calls for increased support, Canada's health system now faces an acute health human resource crisis, characterized by severe worker shortages impacting treatment accessibility and efficiency. Moreover, the current healthcare workforce is experiencing unprecedented stress, burnout, and compassion fatigue, and many are leaving or planning to leave their profession, despite having invested many years in education and training in their chosen professions. While the federal, provincial, and territorial governments have worked to mitigate these challenges, the pervasive issues of staff shortages remain urgent and widespread. According to Statistics Canada, 87% of healthcare workers reported feeling stressed at work, while 45% of workers reported poor mental health compared to the pre-pandemic period. To effectively address the needs of Canada's diverse communities and to combat the widespread shortage of healthcare professionals and the health challenges they face, it is crucial to develop a national health human resource plan. This comprehensive plan should include robust data collection and accountability measures to identify workforce needs, enhanced recruitment and retention strategies, including streamlined accreditation processes and support for interprovincial mobility, a strong emphasis on the mental wellness of healthcare workers, ensuring they have access to support systems and professional development opportunities that promote resilience. Demandons instamment au gouvernement fédéral à collaborer avec les partenaires provinciaux et territoriaux pour mettre en œuvre ces stratégies. Ensemble, nous pouvons mettre en place un personnel de santé durable et capable de répondre aux divers besoins des Canadiens. Heal urges the federal government to collaborate with provincial and territorial partners to implement these strategies. Together, we can build a sustainable health workforce equipped to serve the diverse needs of Canadians.
Thank you, Elisabeth. The mental health landscape in Canada has been deeply impacted by the pandemic, revealing systemic gaps in service delivery. Pre-pandemic, a significant portion of our population, 18% of Canadians aged 15 and older, met the criteria for mood, anxiety, or substance use disorders. Disturbingly, over 1/3 reported unmet health needs. The escalating opioid crisis underscores the urgency of this issue. Since 2016, we have witnessed over 42,000 opioid-related deaths, including nearly 6,000 in the first 8 months of 2023 alone. To effectively tackle these intertwined challenges, we must adopt an integrated approach to mental health and substance use. This can be achieved through investment in multidisciplinary models of care where a range of trained mental health professionals work collaboratively to deliver timely patient and family-centered services. HEAL calls on the federal government to formally recognize the equivalence of mental health and substance use care to physical health. This includes enacting legislation that guarantees principles of comprehensiveness and accessibility. Furthermore, we encourage partnerships across all levels of government to fund evidence-based mental health and substance use services, ensuring they are sustainable and responsive to growing demands.
Lorsque nous parlons des soins communautaires, nous évoquons la nécessité pour notre système de santé d'évoluer pour accompagner les individus tout au long de leur parcours de vie, de la petite enfance aux soins de fin de vie. When we talk about community-based care, we speak to the need for our healthcare system to evolve to support individuals, including marginalized populations, throughout their life journey. from infancy to end-of-life care. The community-based care approach emphasizes providing care where people live, work, and play, ensuring accessibility and continuity. La pandémie a eu un impact durable sur les systèmes sociaux et la santé mentale des enfants. L'isolement des amis, de la famille, des enseignants, des soutiens communautaires et des activités extrascolaires s'avèrent préjudiciables à leur développement. Recent positive investments in programs such as school nutrition, dental care, and accessible daycare services can proactively improve health outcomes for our future generations. More must be done to ensure our children live happy and healthy lives, and this action should start in our communities. For seniors, long-term care in hospitals cannot be the only options. Instead, enabling clinically stable patients to receive care at home, supported by professionals with core competencies in areas such as palliative care, care coordination, and clinical decision-making, to name just a few, will allow seniors and other frail persons to stay in familiar environments with their loved ones and surrounded by a network of caregivers. Les soins en équipe font également une partie de la solution. A key element of effective community-based care is interprofessional collaboration, ensuring healthcare providers work together seamlessly to meet patients' needs. Team-based care facilitates better communication among healthcare professionals, reducing the need for patients to repeat their medical history and ensuring cohesive treatment plans. Importantly, collaborations should extend to all healthcare providers, including those who operate outside the publicly funded system. Many complementary and allied health practitioners play a vital role in holistic patient care. This approach not only enriches patient experiences, but also fosters innovation in care delivery, making the system more resilient and responsive. This approach encourages and supports all healthcare professionals to function to the full extent of their education, certification, and licensure. Les solutions numériques telles que les vidéoconférences et les autres services de télésanté jouent un rôle crucial dans l'amélioration de l'accessibilité et des soins centrés sur la personne et de la famille. Virtual care options allow patients to receive timely and appropriate care regardless of their location, whether in rural and remote areas or urban centers. Through the integration of technology in community-based care, the Canadian healthcare system can provide more effective, efficient, and person-centered care. Il conseille au gouvernement fédéral, en partenariat avec tous les niveaux de gouvernement, d'augmenter les investissements dans les soins de proximité afin d'alléger de manière significative la pression qui pèse sur les secteurs surchargés de notre système de santé. He is advising that the federal government work in partnership with all levels of government, increase investments in community-based care to make meaningful differences in alleviating pressure on overloaded areas of our healthcare system to meet patients where they are.
Thanks, Elizabeth. HEAL commends ongoing actions and efforts that enshrine the federal government's role in healthcare across Canada. As 43 National Health Association, HEAL stands ready to support and work with the federal government in enhancing Canada's healthcare system. As a coalition of diverse healthcare professionals, we are a leading resource for profession-specific research, strategy development, and implementation of policy recommendations to strengthen the Canadian healthcare system. Ensemble, nous pouvons relever les défis actuels, tirer les leçons de notre histoire et de nos expériences vécues et faire avancer les réformes du système de santé au profit de tous les Canadiens. Together, we can address current challenges, learn from our history and lived experiences, and advance reforms to the healthcare system for the benefit of all Canadians. Merci and thank you.